homelessness, mental illness, and addiction cannot be solved solely by the police department, solely by social services, solely by locals or the state. We've all got to come together, and as a police department, we are committed to working with our partners in the community to reduce the crime that is occurring while we work on the front end and continue to be proactive. We do need more shelter beds, we do need more mental health beds, and we do need more jail beds. And we're not going to incarcerate drug users just to punish them, though that is part of the criminal justice system. But when we do that, we need to get them the assistance. We need to get them assessed in the jail. We need to get them treatment started in the jail, and then we need them to release to a different environment and then back to the street where the drugs are available. Our teams are going to continue to work closely with our allied law enforcement agencies. The Department of Public Safety is a great partner and is helping us here in the city. We're going to continue to go after the drug distribution networks, and we need to reduce supply, but we also need to reduce demand, and we need to get people off of the streets and create a better environment. And we're committed to doing that at the Salt Lake City Police Department. Thank you.
Do we have time for a couple questions, if there are any?
Mayor, what are your thoughts about the governor's speaker and the president's letter to the Utah Homeless Services Board recently urging an expedited response in response to the president's executive order on homelessness? What's your thoughts on that?
I appreciate it, and I appreciate any urgency they bring to getting solutions moving forward around homelessness in the state of Utah. So we'll have meetings coming up over the next several weeks, and I appreciate their sense of urgency. We need it to be followed by response at the legislative and leadership level.
Chief Red, we also saw 36% of chronic homelessness in this last report, and I'm wondering how much of a connection there is with the recent surge in fentanyl interdiction in the state, and whether this increased supply of drugs is also related to increased chronic homelessness.
There is an overlap. The data is clear. There is an overlap between the drugs, the transient related crime, and violent crime. There is an overlap. So we do have to go after the drug distribution networks. As I mentioned last month, the price of fentanyl is up. We are enforcing camping. We are enforcing drug distribution, all of it, but yeah, there is a connection to those things, and so we're going to continue to strike at the heart of the drug dealing.
I want to make a quick comment that the approach that we've been talking about for many years of this high utilizer focus that Miami-Dade County in Florida has been doing for over 23 years really is more urgent than ever, because fentanyl is so devastating. We have to remove these individuals from the environment of use to become sober and make decisions in a sober environment that then hold them accountable after they leave jail. Holds them accountable perhaps through the criminal justice system, as Miami-Dade County does, and that's the approach that we're exploring with the partners I mentioned earlier. This is a really small fraction of the total population of individuals who experience homelessness over the course of any given year in the state of Utah. And of course, there's plenty of individuals who aren't homeless who are also contributing to the fentanyl use and distribution. But we know that if we can focus on this very small relative population within Utah, in the homelessness realm, we will have a disproportionately positive impact on capacity across the system and financial savings at every point.
Mayor?
Yes.
Knowing that we have these vulnerable populations, such as children, seniors, veterans, how are Salt Lake City services being tailored to meet these unique needs of these rising groups?
Yeah, great. Thank you for that question. How is Salt Lake City responding specifically? We have invested more money in affordable housing over the last 6 years than the entirety of Salt Lake City's history. It's contributed to the creation of, I don't know what the most recent count is, over 6,000 affordable housing units. And we've been prioritizing some of that funding for family-sized affordability. This year, we're putting $5 million out to the private market to create deeply affordable housing. We've always wanted deeply, but it's harder to build. This year we're just putting $5 million out for deeply affordable. And I want to also mention that in October we opened our Tenant Resource Center. They're officed at the Community Development Corporation of Utah on 17 South. We have resources for people who are in housing and know that they're going to be losing it because they don't have the money. Their apartment's been bought and it will be demolished, or remodels are happening that are causing displacement. We can not only help them find new housing in areas that they want, but we have money to help them do so. So those are some of the ways that we're working to try to stabilize families.
Is there any update on the personal hygiene program that was launched?
Yes, we will have an update for you soon. We've contracted with the company who will be running the personal hygiene program out in the community. I can't give you the name and the update on that today, but we've signed the contracts and it's coming very soon. One more?
As, I mean, heading into next winter, or this winter, there's still no homeless campus, even though the deadline was around October. It doesn't look like that's going to happen. Do you have any additional thoughts about having to do another year of emergency winter response with no homeless campus, whether it's temporary or permanent?
Yeah, I have two thoughts that are, they should be upsetting to all of us. One is that there won't be enough beds. And we haven't had the state respond, as they will by the end of August, to the submitted plans from each county for the number of beds that will be needed. I'm very doubtful that those beds will be available. So we almost assuredly will have people on the streets with no option of space to go. The second and the most poignant part, in a way, is that the State Office of Homeless Services does not have funding to continue those beds after April. They have continued, I think, over 800 of those winter shelter beds into this summer because they had the funding from the legislature to do so. That funding does not exist right now. So come the end of the winter shelter season, everyone who's in one of the 900 plus beds that were created this year would be out on the streets. And the impact in our downtown core, throughout our neighborhoods and parks and trail system, of 1,000 plus people flooding out with no option of places to go is very alarming. That's why, even though the legislature isn't starting this month or what feels like anytime soon, we can't wait. These numbers of an 18% increase are startling. They should not be surprising, though, because we've never been on a decrease and we continue to grow as a state. Thank you all for coming out. We appreciate your attention today.